All right, this is part two. Okay, my name is Alomari, Pharm.D. It is Thursday, May 26th, 2022, 4:23 p.m. And I just read the California governor signed the medical injury um, uh, law that ups the if a physician is sued for malpractice, or any healthcare provider, physician, nurse, any healthcare provider, pharmacist, anybody that works for the hospital or institution hospital is sued. The cap was 250,000. The family couldn't get more than that. Now they just signed a medical bill. I mean, a law, not a medical bill. They signed a law to up it over the next 10 years to up to 500,000. And that's just ridiculous and crazy. And I'm really, really surprised that the governor would really sign such a bill like that. So sad, so fucking sad as a healthcare provider that physicians would actually allow this to happen. And I come from risk management in Detroit, Michigan, and um, I fought for the healthcare provider. I was always on the side of the healthcare provider, and I was on the side of the healthcare provider because I worked for the hospital, and I worked with risk management. And I was employed by the pharmacy department, but I worked with risk management. And risk management is basically tasked with the job of protecting the healthcare provider and the institution at large from huge lawsuits, and that so the hospital wouldn't go bankrupt, and to allow the limits to be increased is just horrendous, because it means medical malpractice will go up, unfortunately, and the physicians will, you know, um, be financially damaged if a lawsuit were to come to um, a win. And I'm really disappointed from the governor by signing a stupid law. First and foremost, I'm totally against it, because I believe in just culture. And I was trained by Ascension Health Risk Management Department, which were primarily nurses that converted into risk management. And instead of hiring lawyers, the hospital hires nurses and pharmacists like myself to do their risk management and to review their cases and to prove the innocence of the provider for the most part. Now, there is negligence. Yes, there's medical negligence. That's one thing. There's also mistakes and slips, and that is not the fault of the provider. That is the fault of the system. And if you understood anything about just culture, you would understand that that kind of bill is not going to be a plus for any healthcare provider going forward. And it's really sad that California has not adopted the just culture. Now, I don't know that they haven't or they have, but based on signing a bill like this, tells me that they're very um, not on the side of progressive medicine, not on the side of just culture, and not on the side of how I was trained in Detroit, Michigan. And so it's a disappointment, huge disappointment. And now I was a med safety officer in Michigan, Detroit, and I guess I was graced and loved by the health risk management department, who reported to the CEOs of the hospital. They were a direct report, and so I always had first line communication with the hospital vice president and CEO and CFO, and not CFO, but all the clinical people, the CNO, the chief nursing officer, chief medical officer, the physician, and chief of risk management. So we became really, really good friends. And in fact, we met once a week to review all the mortality cases in the hospital and decide if they were natural death, progression of a disease, versus medical error. And the medical error ones, I got to look at. Medication errors, I got to review. And that was part of my job for the 8 years that I worked for them. So, I don't know. I don't know what to say about that. I'm just disappointed. That's it. The governor's kind of clueless about just culture. He's really clueless about healthcare in general. And it's a disappointment that pharmacists don't stand up to him. Um, and because the California Board of Pharmacy won't allow me to reciprocate my license from Michigan, they're prohibiting me from practicing as a pharmacist here. And there's nothing I can do about it. There's nothing I can do about it except work for the federal VA hospital. But they're not hiring right now. And every time a position opens, they give it to a new grad, somebody younger, and they won't give it to me. So I'm basically without a job. And so the California Board of Pharmacy and the California California governor and the California state of, government, is not a government that I really appreciate. I don't trust them. I don't appreciate them. And I will not advocate for them. Because they won't advocate for me as a healthcare provider. So, I guess, long story short, I've been on both sides of this, and when I was working for Ascension Health, I was always on the side of the care provider. Now, I did see care providers that actually were grossly negligent, and they were because of many root causes, and working long hours, being really, really tired, ordering medication without looking at the patient, and the patient happened to be like 80 pounds instead of 180 pounds, and so they, overdosed the patient, and the patient died. So those are really simple examples of how your work environment causes error and death. And those are things I looked at for medications in the hospital. And so you can understand now why I was happy to walk away, because with that came grief, grief of grieving the Holy Spirit because of all those errors and them never really coming clean with anyone. And all that grief would drop on the person that was reviewing the case. So I was always reviewing the case with those managers, which were typically nurses. And nurses, I think, are used to that kind of grief. A pharmacist, like myself, I'm not used to that kind of grief. I'm not used to, reviewing death cases every single day. That's not why I went to pharmacy school, is to review why people die. I went to pharmacy school so we can help people live. And so when my job turned into reviewing death cases, it was just a dissatisfaction of my job. And so people started paying attention to those death cases. And anyway, that's all I got on that. There's nothing else to say about it. It disappoints me, because it's like, as a professional pharmacist, I've never killed a patient. I've never made a severe error like that to cause patient harm or death. And people do every single day, and they get away with it, and they still have their 6-figure salary, and I have nothing. And that's what I'm angry about. These pharmacists are the ones who pushed me out of my career. The pharmacists in Michigan are the ones responsible for kicking me out of my job, because I used to review their medication errors that caused patient death, and they didn't like me because I was outing them on their errors. And the hospital protected them, the director of pharmacy protected them. I was forced to say they didn't do anything wrong, even though they did. And I wish I had the right to report them to the police, to put them through or at least the same thing they put me through, you're not going to work for 3 years until you go back to pharmacy school and memorize all these drug names, because you've made so many errors, you've killed so many patients that you're not safe anymore to practice. And so they turned everything on me, even though they were the ones making the mistakes and killing our patients. And that's how an asshole um, picks the wrong person, and they call that phenomenon. um, I forgot what the phenomenon was called, but basically sticking somebody else in. You commit the crime, but then you blame somebody else on it. So that's what happened with me. And so all I got to say is fuck you. I'll get you back somehow, you fuckers. You fuckers in Michigan. You fucker pharmacists in Michigan. I will get you back, you fuckers. I will get you back one day. I will do the same fucking thing to your career, you evil bastards. You're all men and you're all fucking nasty. And somebody will eat you alive for what you did to me as a woman. Somebody will eat you alive. And that's all I got to say. They ruined my life, and I absolutely abhor them. They're all white men pharmacists that make errors and kill patients, and they get away with it. And I end up homeless, without a job, and without a career, and my entire reputation just smeared, you know. And my family has nothing to do about it or say about it. That's what happened. That was in 2013, April 2013. That's what happened. And I'm 9 years, 9 years post their abuse and defamation. And, I hope that God gives me a way to sue them and come back a winner somehow. I have two pharmacists in particular that I could definitely sue for harassment. Um, yeah. So that's what happened. It had nothing to do with my family, my mother, my father, or my brother. It was all a hoax.